And had a hip revision. I'd had both hips replaced, and it was early on in my early 50s, and the balls started to wear. And so I went in, this was the worst on my right side. And after I had the surgery, he told me that he could tell he had some difficulty getting past the sciatic nerve and the scar tissue that was already there, and that it had been pulled. He had to pull it, and resulted in drop foot. Supposedly it was supposed to come back and take time, but within 6 months it was supposed to come back. And it's been almost 4 years. And I did have physical therapy, and he looked at it and said I could stretch my toes, and I really didn't have, I had a TENS unit that they had used that I was able to rent to own. Okay. And I used that TENS unit for a while and did some exercises on a piece of foam, a half piece of foam, like a long piece that was cut in half, and just try and stretch. When I went back to the doctor, I would ask him, should I have acupuncture? What else could I do? Is there somewhere else I could see? He had to wait, said really I needed to wait for it. It took, was a millimeter or something a month. It was very slow in supposedly regenerating again, but it didn't. It was supposed to be within 6 months, and it didn't. And so I kept working away thinking, well, maybe it's going to take a little longer, which he said it might take a little longer. And pretty soon my legs started to atrophy, and I noticed the muscle strength wasn't there, and even the foot, when I would walk, it doesn't go straight out. It's sort of, it's weak. It fluctuates out to the side. It's sort of an unruly foot compared to the other one. Well, you basically can't lift your foot up when you walk. If I was walking with my bare feet, you could not hear one foot drop, but you can hear the other foot slap against the floor. And my leg has atrophied to a point also. Well, this is, I was at the dentist, and one of the magazines that you have in your office was in her office. And my husband was waiting for me, and he was looking through there and reading the articles and saw the one about Dr. Kukurin, and he looked at that, and then he had his smartphone and he's checking out, looking up the website, and he says, this really sounds interesting, and he came in and told me about it. And we called and asked, basically, would he be able to work with drop foot? And we were told he could. See what we could do, and I didn't really expect to be running around in the parking lot with it. I was hoping I just would get a bit more mobility with it, and not have such a weak ankle. I was hopeful, but I wasn't sure. I was hopeful, but I've been hopeful all the way along. I was afraid I'd be disappointed again, but as soon as I came in and he had a plan worked out and so many visits, and I could see the result by his filming of this, and I was floored. I didn't see it happen that fast because it's just a little bit, but once he showed me the before and after, I just couldn't believe the difference in it.
Started treatment 6 weeks ago.
Yeah.
And you've been coming in faithfully 3 times a week.
Hour and a half
for
appointments. 6
weeks. So that's this is your 18th appointment.
Yes.
Okay. So tell me right now, explain to me how your function is with your foot now.
I'm not wearing it was just a simple cloth brace for stability on my ankle, and Dr. Kukurin even mentioned that you might want to try not to use that as much, and so I've gone about, the last week or so. I don't have it on when I'm home, when I'm walking around in the house. I basically put it on when I would go out somewhere, just for stability for my own mind. And I haven't been wearing it, and I've been doing fine. I have to think when I put down my foot, but I'm able to function pretty good with it and move my foot up and down, my toes.
Absolutely. So would you recommend our practice?
Oh, I absolutely would. In fact, I'm going to be coming back, and he's going to keep an eye and make sure that I don't lose any ground on it.
One more thing. I just need you to state for the record that you give us permission to use this.
Oh, I give permission to use this. I'm thrilled about it.